Well, there is a program in Medicaid called these disproportionate share payments, and those payments are not tied to individuals who are eligible for the program, but they are special payments that the states make to hospitals that serve a disproportionate number and amount of people on Medicaid and people who are uninsured. So those payments are there. They have been there as part of the program, but often they are not sufficient to meet the entire need of uncompensated care. And again, hospitals and emergency departments are seeing a greater number of people because of their losing insurance.
In my area, all children are eligible for CHIP. But many of the parents who are, and it doesn't make any difference with children whether they are citizens or not, if they are living in the country, going to school, but many of the parents are not, and that's who shows up in the emergency rooms. Does disproportionate share determine citizenship before the money is reimbursed?
Well, different states have different rules on how that money is dispersed across the states, but really it's it's designed to help hospitals that serve people who are uninsured and people who, and hospitals and facilities that serve a high number of Medicaid patients. So, you know, there's not really a full eligibility determination made in allocating those dollars.
Who are the uninsured now? I know people that have been lost coverage through losing a job, but there are also quite a few others that have not lost jobs.
Right. Well, in fact, you know, of the 46 million people who are in the country that, you know, who don't have insurance, most of them are in working families. So 8 out of 10 are in working families. So they're either working full-time or part-time, but often work for firms or employers that just don't offer coverage to their to them or to their families. So, and for the small number that do have coverage offered to them, often because they're low income, their coverage is even too expensive for them to participate in it. So, so again, these are mostly working families. I think, again, because of the recession, you have more middle-income families really at risk of becoming uninsured if they lose their job. But primarily, we're talking about people who are working but low income, and their firm or employer just doesn't offer coverage to them.
What are the options for people who are unemployed but they still want to purchase health insurance?
Well, for someone who just recently lost their job, if they were participating in their employer coverage, they would have the option to participate in a COBRA. So they could continue their employer coverage even though they don't have their job. Often that coverage is very expensive because when you're working, usually you share in the costs with your employer, so you only pay a small amount, on average about a third of the cost of the premium. But when you become uninsured, if you want to participate in COBRA, you're paying both the employee and the employer share. So it's very expensive. There was part of the stimulus funds was designed to provide a subsidy to help individuals continue that coverage. But even with a 65% subsidy, a family policy could still be something like $300 to $400 a month. So if you don't have a job, that is pretty expensive. So while it's helped some people still find it unaffordable. We talked before for kids, you know, there's public coverage generally that's available. So while parents and adults without dependent children might not be eligible, kids are often protected and have a safety net in Medicaid or Children's Health Insurance Program. So that's coverage for them. And then there's the individual market, but that's tough for individuals to get coverage in the current individual market because it's expensive. The policies are very expensive. They might not be very comprehensive. And if you have any pre-existing condition, often those policies are just not available to you. So it's there are a few options, good options right now.
How are our state budgets being affected by this? I know that, excuse me, some are being affected more than others, but I know that my state of Texas has been severely affected because we have so many working people that don't have insurance because they can't afford it or the company does not offer them the opportunity. And many times there's nothing else available that they can pay into.
Mm-hmm.
And so the disproportionate share is from federal, but also some from state. So since the recession has started, it's been going on a while, do you have any idea how state budgets are being affected?
Yeah, well, certainly the recession has had a huge impact on state budgets total and on state Medicaid programs. We know that across the country, states are facing budget shortfalls of something like $350 billion for the rest of their 2010 budget year and through 2011. And it's always, as unemployment rises, state revenues fall, and it's right at the same time that more people are coming onto programs like Medicaid and CHIP. So it's a real crunch for state budgets because demand is increasing right at the time that states can least afford to support the programs that people rely on. You know, it's to say the states are facing fiscal challenges is a huge understatement. I think the funds that were provided as part of the federal stimulus bill, or the American Recovery and Reinvestment Act, were critical in really helping states close some of their budget shortfalls and address some of these issues around helping maintain their Medicaid programs.
So as long as we have not completed some health care reform, the states and local governments, I guess, county government, would still be impacted much more. And probably the longer we don't have it, there will be more people that can't afford it. So how do you see healthcare reforms impact on our economy?
Well, you know, there are some studies that show that, you know, the trends have been that there's going to be this continued erosion in employer coverage. So, you know, there's likely to be a continued increase in the number of people without insurance, which definitely puts strains on state budgets. In the interim, before health reform could even take effect, so the problem will likely get worse before it gets better. And states are definitely struggling right now. So in order to do any expansions through the Medicaid program, that's really, the financing is shared between the states and the federal government. It's really important to have additional federal support to help provide coverage to these new people that are coming onto the program.
Now, the education recovery did have portions to address those areas, but how far did it go? How many more people that got some relief from it?
Well, that's a tricky question. We know, because we just did this survey that we put out last week, and we asked states how did you use the recovery funds? And again, most of the recovery funds that were targeted to states were really through Medicaid. Again, this financing for Medicaid is shared between the federal and state governments, and essentially the recovery package increased the amount that the federal government would pay for Medicaid. As a condition for getting that money, states had to agree to not restrict their eligibility for Medicaid or make it harder to get onto the program. When we asked states how these funds had affected them, they said they really used the funds to help close budget shortfalls in the state. You know, states can't run deficits; they need to balance their budget every year. So that was critical. It also helped them to support providers. So many states would have no other option but to cut provider rates. Some states still did that, but they were able to soften those cuts or avoid them. And of course, these requirements to not cut eligibility really did help protect enrollment in the program. Because states were not able to cut back on eligibility. So states found it, critical in really helping them through this very difficult period. And I think states are very concerned about what happens when these funds end at the end of 2010.